Thank you, Ranking Member Barton. My name is John Shadegg. I'm from the 3rd District of Arizona, and healthcare reform has been a passion of mine since I got here. I worked on Patients' Bill of Rights reforms with Tom Coburn in the House clear back in 1995, 1996, 1997. I have written a comprehensive healthcare reform bill every year I've been here. I have written legislation to enable people to buy health insurance across state lines so they could get it at an affordable rate. Let me make it clear there are things we agree upon, and you've heard them here, but I want to make sure you understand them. Republicans believe in and support legislation to fix the problem for people with pre-existing conditions and chronic conditions. We believe that those people ought to be able to buy health care through a high-risk pooling mechanism or a reinsurance program at the same cost as every single one of us. Every one of them should, and this isn't just talk. We passed legislation to encourage states to do that through state high-risk pooling mechanisms at least 4 years ago. I know because I wrote the bill. So there's agreement on that issue. If we Republicans would like to go further now and make that a national high-risk pool so it covers everybody. Second, covering all Americans. Many of the Republicans that have been working on health care reform, including myself, Mr. Ryan, Dr. Coburn, Richard Burr, and others, have offered legislation that covers every single American. We would give every single American a refundable advanceable tax credit to cover every single one of them. Those are the two biggest issues. But let's talk about where we don't agree. We believe that the tax code has to be fixed. It is an outrage to say to American businesses, you can buy health insurance with pre-tax dollars, but we want everyone else who doesn't have an employer-sponsored plan to be responsible and buy it, but we're going to smack you down by making it cost you a third more. That's the law in America today. If any one of you people sitting here right now, don't have employer-based health insurance and you want to buy it on your own, you got to buy it with after-tax dollars. That's unfair, that's an outrage, and I've been trying to fix it since I got here. Every one of these Republicans wants to fix that problem and to empower people. There's a fundamental difference in this issue. That fundamental difference is the Democrats want a top-down, bureaucracy-driven, punishment-driven, command people around, mandate coverage by businesses, mandate coverage by individuals, and punish them if they don't comply. Republicans want to empower you. I'm not talking vagaries. I'm talking about you, ma'am, right there. I want to empower you to be able to buy your own health insurance plan with,
maybe her too, him.
And every single one of them, to be able to buy your plan. The Democrats talk a lot about abuse. They talk about plans that cancel people. You know how plans get away with canceling people? Your employer buys the plan, and he has a motive not to look out for you as carefully as perhaps you would look out for you. And you can't fire that plan. If you could pick out the plan, you wouldn't accept the terms your employer picks. You'd pick out a plan and you'd read it to be sure they couldn't cancel you. And that's what we want for you. We want you to be able to buy a plan that can't cancel you, and if they threaten to cancel you, you fire that plan and you go buy a plan that can't cancel you. We want to empower people.